I'm going to follow on Manfred Weiss's wonderful example and start on time so that all of our speakers will have the full time allotted. And some of you know that after the afternoon, when this session is concluded, there'll be a short break, but there will be a mass at the nearby church of San Agostino in memory of Marco Biagi, and obviously some people will want to go to that. Many of our papers today have multiple authors, so I have placed the responsibility on the authors for dividing the time between themselves as they wish. But it is 15 minutes approximately per presentation, so that we might have a few minutes for discussion at the end. So it's always difficult to do a late afternoon session. My name is Janice Bellace. I have been coming to this conference since the very beginning. I knew Marco Biagi very well from the 1980s, and it is my pleasure to do this afternoon session, to chair it, which follows in its theme very closely upon the prior session, since it is entitled Rethinking the Protections of Vulnerable Workers. Since John did not step forward, and therefore we may have more time than I realize, let me say that we will start then with Carmela, Garofalo, and Caterina Mazzanti discussing disability and COVID-19 integration policies during and after the pandemic. So I don't know which one's coming first. Is it Caterina? Okay, if you both want to come up, and one of you sit there and the other one stand up. Okay, yeah. And he turned on the, do you have a PowerPoint? Because I don't see it on the screen yet, you know. Okay. Okay, don't worry. Are you John? Okay, then, okay, great. Yeah, they said they're loading it. It'll be on very shortly. Okay. Yeah, he said, you might want to ask the technician. Oh, there it is. Okay, okay. If you want to stand up at the microphone, because you need it for the clicker. See if it works. Oh, you could use my, you were one short. I have a feeling you're going to stand up. But you need a microphone. Oh, you're going to go first? Okay, go ahead. But does she need the clicker, or you could? Okay, go ahead, thank you.
Good afternoon. The topic that my colleague Caterina Mazzanti and I presenting looks at the measure adopted by Italian legislation in favor of workers with disabilities during and after the COVID-19 pandemic. In order to address the main points of the discussion, we must first look at the result achieved before the pandemic. Today, the inclusive and anti-discrimination legislation in favor of people with disabilities revolves around two key concepts. The first is the broad notion of disability, and the second is so-called reasonable accommodations. Starting from the first aspect, the medical model of disabilities was abandoned in favor of the biopsychosocial model, in which disabilities is not necessarily linked to subjective conditions and medical assessments, but to the person's interaction with the environment. This model has made it possible to broaden the definition of disability over time to include chronic or long-term illness, if and to the extent it effectively compromises the person's participation in social and professional life in the long term. To ensure the disabled person's work integration, employers were then required to adopt so-called reasonable accommodations, which can be defined as effective and practical measures aimed at arranging the workplace according to the disability. The only limit to the adoption of these measures is the disproportionate financial and organizational burden on the part of the employer. Within this regulatory framework, the effectiveness of inclusive policies depends on several factors, including the availability of public resources intended for their financing, and inclusive and solidaristic contribution of employers. In Italy, the shortage or misuse of financial resources, the chronic lack of collaboration on the part of employers, and absence of a true cultural and social change toward the treatment of frailty have an important influence on the failure of inclusive policies for workers with disabilities. There is no doubt that the COVID-19 pandemic has aggravated the working dimension of people with disabilities, which is already severely compromised. At the height of the health emergency during lockdown, disability measures proved to be ineffective, if not penalizing, with the total hibernation of work integration for people with disabilities. Italy has chosen to adopt specific emergency measures to protect the physical or mental condition of people with disability. In acute phase of the health emergency, the following measures were adopted: the suspension of targeting placement, the suspension of the conditionality linked to the mandatory hiring of people with disabilities, the suspension of convocation by employment center to participate in orientation initiatives. However, the block on people with disabilities, work placement, was compensated with measures that have guaranteed the continuity of assistance to the disabled and the protection of their incomes. For caregivers and for those with severe disabilities, paid leave days were increased by 12 days until June 2020. Work absences were required to hospitalization, thus allowing for public and private employees who are immunosuppressed, oncological patients, or having a severe disability to receive full pay for the entire duration of the state of emergency. In this phase, remote working played an important role. Vulnerable workers and working parents with at least one child with severe disabilities or with special educational needs were afforded the right to remote working. During the state of emergency, remote work became a tool to prevent COVID infection, and where possible, it has been the mandatory work method for workers with disabilities. In the current recovery phase, it's necessary to pay the utmost attention to workers with disabilities who have been severely hit by containment measures. In the future, workers with disabilities will be more exposed to the risk of marginalization in or expulsion from workplace, as they are deemed unsuitable for new ways of working or considered a burden for companies already in crisis. Therefore, there is a measure launched in Italy as strengthening the work and the social integration of people with disabilities in order to counteract the inequalities of their treatment during the pandemic. Starting from the Italian recovery plan, the issue of disabilities is recognized as one of the transversal priorities to which fully inclusive reform interventions should be addressed in the implementation of supranational principles. Law number 227 of 2021 was the first reform of the subject of disability with Italian recovery plan resources. The Italian government was tasked with updating the definition of disability and introducing the definition of reasonable accommodation into Law 104 of 1992 to cohere with the provision of the UN Convention. In parallel with the enabling law on disability reform, guidelines on targeting placement have been recently adopted, through which an interinstitutional collaboration process capable of supporting the employment of people with disabilities is promoted. These guidelines complement regional regulations with the aim of outlining an overall framework of principles, interventions, and implementation methodologies to make the right to work of the disabled effective. Particular attention is given to the definition of the adaptation to be implemented as part of the mandatory placement of the disabled. The role of remote working in the post-emergency phase remains paramount. Remote work is qualified in all respects as a reasonable accommodation for workers with disability or vulnerable workers. The experience gained in the field of remote work during the pandemic led the government and the trade unions to sign the National Memorandum of Remote Work on December 7, 2021, which provides guidelines for collective bargaining, in which in Article 10 facilitates access for workers with chronic health conditions and disabilities as an inclusive tool and as a reasonable accommodation measure. The protocol is also guiding the work of the legislator in the post-emergency phase. A text inspired by the contents on the information memorandum amending the regulation on remote working is currently being adopted. Collective bargaining is assigned the task of regulating the right of priority for requests to carry out remote work done by 4 types of subjects, including people with disabilities and their caregivers. Yet, some vulnerable subjects still remain outside the previously described picture. They are invisible because they do not fit into the regulatory classification, as they are not properly considered disabled, and they have not been dedicated a specific intervention to improve their living and working conditions. My colleague Caterina Mazzanti will explain this aspect.
Thank you, Carmela. It works. Well, as highlighted by my colleague, well, as highlighted by my colleague, in defining the category of fragile workers or vulnerable workers, fragile worker is the expression we usually use in Italy, the legislator does not include people with high-functioning autism. Consequently, during the pandemic, they have been invisible since no specific measures have been adopted to address this issue. The goal of our presentation is to show the condition of social exclusion and of exclusion from the labor market of people with high-functioning autism. It is an issue that requires the attention of both legislator and social parties, especially in the context of the pandemic. As pointed out by my colleague Carmela, high-functioning autism is not a disability. Why? Because the people affected by this disorder are not intellectually disabled. They develop verbal language, but encounters enormous difficulties in social interaction, in controlling their emotions, in understanding nonverbal language. These characteristics provoke difficulties in social relations, where people with high-functioning autism show a tendential lack of empathy in the sense of an inadequate interaction with other people, according to the common experience. So these difficulties provoke social marginalization and then unemployment. To tackle the issue, we need to understand what are the high-functioning autism spectrum disorders. They are extremely various and have an unknown origin. They are characterized by their lightness when compared to other forms of autism. Those aspects are very common in people with Asperger's syndrome, called commonly ASPI, which is consequently considered a form of high-functioning autism. People affected by this disorder often have monothematic interests, but if able to overcome the social barriers that they encounter, Aspis have many strengths, especially at work, showing creativity in particular. Well, which is the risk faced by people with such disorders in the employment relation and in the labor market? The risk is that of discrimination. At this regard, I must point out that data relating to the disorder in the female population are very poor. Diagnosis mainly concerns men and less women. Although there is no unanimity among scholars for this statistical discrepancy, in some cases it has been observed that women, since they perceive their gender as a further diversity, added to that of being Asperger, try to hide their true nature. Likewise, even being an elderly person affected by these syndromes can lead to social isolation and difficulties in the working environment. So the solution might be the adoption of reasonable accommodation in favor of people with high-functioning autism spectrum disorder. The adoption of reasonable accommodations in the workplace are necessary to eliminate the obstacles that to lead a free and dignified existence in condition of equality according to Article 3 of the Italian Constitution. At this purpose, reasonable accommodations must be put in place starting from the job interview, and therefore from the moment of the interview with the candidate. So it is necessary to rethink to disability as a dynamic notion, which places the emphasis on social barriers in the interaction with people, rather than on disabled person impairments, as pointed out also by the UN Convention on the Rights of Persons with Disabilities. As highlighted by my colleague Carmela, this approach leads to an extension of the notion of disability. Nevertheless, an expansion of the notion of disability might not be coherent with the idea of including Asperger's and more generally high-functioning disorders in the neurodiversity. This idea emphasizes the potential and qualities of the person to promote its inclusion. Is it possible to adopt a common solution for all people with high-functioning spectrum disorders? To this question, I would answer no. These disorders constitute, we can say, a universe within a universe, and it is necessary to have regard to specific cases since the impact of such disorders varies from person to person. As pointed out by my colleague, nowadays remote work is qualified as a reasonable accommodation for people with disability. Then the question arises whether remote work can represent an adequate adjustment for people with high-functioning autism spectrum disorders. This way of working accentuates the isolation and can lead to a worsening of the quality of life, so much so that it is not possible, in my personal opinion, to qualify it in terms of a reasonable accommodation for people with high-functioning autism spectrum disorder. Consequently, it is preferable to allow them to work whenever possible at the workplace in order to prevent the problem of isolation. Focusing, in conclusion, on the labor market, it should be highlighted that in Italy, there are no active policy measures aimed at the labor inclusion of non-disabled people, but with high-functioning autism spectrum disorder. With respect to people with autism, a first step towards the goal of job inclusion was taken by the legislator in 2015 with the introduction of the Framework Law number 134, on the diagnosis, treatment, and qualification of people with autism spectrum disorder. However, a definition of person with autism spectrum disorder is missing, and this gap has generated problems in the implementation of the law at the regional level. Considering the substantial failure of the law, the tool that best leads to respond to specific needs of individuals with psychosocial vulnerability is represented by the personalized health budget. It aims at creating an individual project tailored to its characteristics with an innovative approach. And in this idea, the state allows citizens to think on services according to their personal needs in the direction of greater autonomy and empowerment of the individual. Coming to the conclusions, even the new measure adopted by the legislator for people with disabilities and explained before by my colleague Carmela Garofalo are probably not adequate for people with neurodiversity, for people with high-functioning autism spectrum disorders. After the pandemic, we might say that the legislator has strengthened the protection of people with disability according to supranational principle. From the other side, neurodiverse people are still invisible. Also, neurodiversity is an opportunity of enrichment, especially in the workplace, in human and in economic terms. Thank you for your attention.
Thank you. Thank you. And if you sit in the front so that one more. Okay. John, do you want to come up? Thank you. Our next speaker is John Geary from the University College Dublin, who's going to be actually talking about a population survey that was done that's quite fascinating.
Okay, thank you, Janice. And good afternoon, everybody. I have to begin with personal remarks and to say how grateful I am that we're all together again at conferences and workshops like this. It's been 3 years since I've had the opportunity to attend a conference, and I must say it was wonderful to go rooting for my passport this morning, even though it was 4 o'clock in the morning, and I'm still somewhat tired, but it's wonderful to be here. I really liked the theme that Jacopo, Olga, Jenny and colleagues put together for our conference over these 2 days, how we might learn from the pandemic and how we might develop a human-centered form of work into the future. Because it coincided with a survey that I and colleagues conducted in Ireland, a national representative survey, of over 2,000 workers, which in the circumstances is unique. And we have some fascinating findings around the effects of COVID-19 on the quality of work and on people's well-being, including their mental health. The sample in the study is basically divided in two: those who we came to call our essential workers. They're the workers who, excuse the sexism, but manned up. They're the ones that went into the hospitals as nurses and doctors. They're the ones that transported goods and services, our essential workers. I'm not going to talk about those workers in this presentation. Rather, I'm going to concentrate on us. We were the ones who let them go out to work, and we had the comfort of working at home. And the question to ask, or I ask in this presentation, the paper is written with a colleague, and it's in the pack. My co-author is Maria Bellazon. And we asked the question, well, what effects did remote working have on people? And for this presentation, then I'll ask, well, what lessons can we learn in respect of going forward? Okay, so we might begin by asking, was working at home during the pandemic something like this? It wasn't my home study or my home office, I can tell you, but my wife's approximated to something like this. She doesn't know I took the photograph, but it was something like this. A serene environment where the worker, as it were, so-called, was able to work in some comfort. Excuse the fuzziness of this, but when you take photographs illegally from Spotify, this is what happens. But you can see this person is able to have a coffee, a croissant, is able to contemplate the world, is at ease with her work. It's not stressful, it's not demanding. She's probably quite enjoying it, and is probably thinking, will she meet a friend at lunchtime, or will she go for a run, or whatever it might be. And this good, healthy man, this was me 20 years ago, with a kid wrapped around him, but he seems to be able to manage it, seems to be able to juggle a very good work-life balance, minding children and still answer emails and attend to his work. That's one image, but we also have to ask, was it more like something else? Now I'm hearing yeses in the audience. So you can see that combining work with domestic life at home is very challenging indeed. And this next image I chose deliberately and coincidentally coincides with the previous presentation, which denotes that working at home can create isolation, obviously more pronounced perhaps with people with disabilities, or some challenges or difficulties, as we might call them. So this is another possibility in terms of what home working might be like. Our paper is 40 pages long. There's loads of data in it. It's in your pack. I'm going to avoid wherever I can reporting statistical coefficients or any data. I'll keep that to a minimum and highlight in a very brief way what are the headline findings. And although this data is derived from an Irish study, I suspect it's not going to be much different in other European countries. What did we find? The remarkable finding, the loudest finding we had, and employers will love this, and it'll be published in Ireland in the next few days, is that productivity levels increased. The question then, of course, is how did that come to pass? Well, it came to pass because people bloody well worked hard. They put in longer hours, they worked more intensively, so their output and their productivity as measured per hour went up. But that, what we call, sociologists of work call effort intensification, that's associated with the nasty sides of working at home. That is, it generated increased stress levels. People found it very hard to leave their work behind. So we have the debates around disconnecting from work, and I know there's legislation in Italy in this. And it also resulted in a diminishment of people's health and well-being. There's also a gender dimension to this because these effects, these negative effects, affected women much more than they affected men. I think this is one of the few statistics I have, but 43% of women reported an impairment in their mental health and well-being in our survey. Now, the equivalent for men was a third, it's less, but as a man, I have to say it's not an inconsiderable proportion either. It's also the case that women's physical health, so reporting of aches and pains in their shoulders, their backs, was also impaired. But so too were they more likely to say that there was an impairment in their relationship with those with whom they lived in the domestic setting. So you can begin to see now some of the pressures and strains that arose with home working. It was yet again more pronounced for parents who had children. Now, the picture is complex here, but generally what we can say, if you had children in late primary school, as we would say in Ireland, perhaps in Italy, la scuola media, the kids in the age of maybe 8 to 14, that age group, parents with kids of that age experience, particularly women, more stress, more damage to their health and well-being than other women or other parents. Now, there's a big debate in the literature around the sociology of work. It's called the demand resources model. And the idea is if you equip workers with resources, even though their work might be demanding and stressful, they can actually come to find it challenging. So the kind of resources that typically are seen to be necessary are that workers are given considerable discretion in their work. They enjoy job autonomy, they enjoy a say in how their work is performed, and they have good relations with their line manager. So they're seen to be the antecedents or the conditions that help workers get through work that is stressful. Instead of seen as demanding, they actually enjoy it. Okay, but it's dependent on the provision of these resources. Now, they didn't help. So these mitigating or moderating factors didn't lessen the negative effects of home working in our study. The question then we asked, well, was there anything else? Were there any exceptions? And there is, at least from our analysis of the data to this point, only one exception. And that's where a trade union was present. Where a trade union was present, working at home was less likely to be linked to or associated with work intensification. So it's interesting that the presence of collective bargaining is helping to moderate the organization of work and the pressures of work, even though it's being conducted in the home. And that's the only case where instance or factor that seems to be important in mitigating the damaging effects of home working. So what does all this mean then for the future of work? And I might say before I go to the next slide, I've never liked the term the future of work. Never. And I say, but if I was to, and we use it in the paper at the end, but we have it in inverted commas. This to me is the most significant, or among the most significant developments of work. More so than the platform economy, more so than AI, more so than the digital economy. Because in many European countries, up to half of the workforce got a taste of home working. Its good elements and its bad elements. So it seems to me what we've got to do, or what we were trying to do, is to see who won, who lost out, and what were the conditions that promoted beneficial outcomes as opposed to those that created negative outcomes. And just to make the point or emphasize it a little bit more, our relationship with work has been altered very fundamentally. The place that work has in our lives now has been redefined. Not just the place, the physical place, albeit that's important, but our work-life balance has been reconsidered. Our working time and our attitude to working time has been altered. Many more workers now want more flexibility and autonomy in regulating their own working time. And as a consequence, our relationship with our employers is different. But what we found in our survey is actually the mix of preferences. So when we ask people to think ahead, what do they want? Do you want to work at home? Do you want to go back to the office? Do you want a blending or a hybrid arrangement? And yes, there are some patterns in the data. The dominant pattern in the data is a preference for hybrid working. But there's a whole mix of arrangements in there with that. But one of the findings that is particularly interesting and that I want to flag is that those workers with the highest productivity are much more likely to say, I would prefer to remain working at home for at least half or more of the working week. The workers with poor productivity during the pandemic and who worked at home are more likely to say they want to go back into the workplace, which is interesting because it indicates all kinds of selection effects, which has implications for policy and management practice. If you force this issue, you're going to damage the prospect of increased productivity. Who wants hybrid working then? I just want to highlight some things here. People living in cities and commuting belts, not surprisingly, want hybrid working. They want to avoid the commute. The other thing is the longer that people worked at home during the pandemic, so they got a taste of home working, want to remain, at least for part of the working week, at home. Who wants to go back into the workplace? Now, this is interesting because for these people, the office has become a sanctuary, or at least it seemed to be a sanctuary. So the people who said to us, I want to return to the workplace, I want to work in the office when all these social restrictions were lifted, were those who felt during the pandemic that they had to remain connected to their electronic devices. They weren't able to disconnect. Those that experienced mental health effects, those whose well-being was damaged, those whose relations with whom they lived at home, if they were damaged, they were the ones who wanted to go back into the workplace. So again, this highlights the mix of preferences and the mix of reasons that underline these preferences. So how might I bring the presentation to an end? I call them contributions, and the contributions I offer are more questions than conclusions. The first is the one that I flagged earlier. We're now not calling it home working, we're calling it remote working as part of the more popular parlance in Europe. It's a most significant challenge for the reasons that I said earlier. I would argue that the state must act, employers must act, for the reason that employees have got a taste of home working, a taste of remote working. Expectations are becoming embedded. A wait-and-see attitude to see how it will develop post-pandemic is not the way to go. It will establish practice and it will establish a precedent that the law will find difficult to engage with, as will employers. So how will new arrangements be arrived at? Will it be unilaterally defined by management, or will they be unilaterally defined by management? Will they involve consultation with employees and their representatives or trade unions? I suggest that the latter route is the better one if we want to find a human-centered recovery, because the evidence from our studies suggests that unions play an important role in moderating the harmful effects of home working.
One more?
Yeah.
Go ahead.
It's the last one.
This one.
Some other things that I want to highlight that are not commented upon. Remote working allows people to work at home. They can go to Modena if you live in Dublin. You can go to Algeria. You can go wherever you want. But the danger of that is you become a cost, and the incentive for the employer is now to subcontract that work out. So the cost of labor can be cheaper, and you may lose your permanency or your permanent contract of employment. So one of the things that I would anticipate is that employers will begin to see the benefit of that. Why not source labor somewhere else where it's cheaper? Second question, does a right to work remotely need to be matched with a right to be permitted to go back to the workplace, to go back to the office, given the evidence that we have? I've already commented on productivity levels and how that might be garnered. Yeah, I'll leave it there. Thanks, Janice.
Right, thank
Thank
you
you.
very much. I was going to say, some employers are saying about cheap. Thank you. The next paper has multiple authors from the University of Luxembourg and the University of Tilburg in the Netherlands, and I will let them decide. I can see Mijke and Antonio, I think, are going to present and share the time. Do you have a PowerPoint? Yes. Okay. I don't know if it's going to come up. Yeah, see if the IT guy's back here. IT guy wonders if he can sit here. I was going to say that in the 1 minute we have that some employers are already anticipating, we don't have to have an office, we don't have to spend any money. You, the worker, can provide your own office and spend the money. Who's going first, Antonio? Okay. Antonio is going to go first on the paper Equal Yet Poor. Thank you.
Okay. Hi everyone. We are going to speak together, Mijke and I, so I will try to be very short to keep it in 5 minutes. I will try to introduce the topic. We are going to talk about atypical work and the limitations of the current legal framework protecting atypical workers, particularly of the principle of equality. This is the main topic of our contribution to this conference. It's one of the, but it's only one of the multiple outcomes of the project Working Yet Poor, in which we are working together with many other researchers and colleagues from different universities in Europe that is studying inward poverty and the role of labor law in relation to inward poverty in Europe. The project started before the COVID-19 pandemic, and also the data we have been using so far are data before the pandemic, because the statistics always come with a certain delay after reality. So we will start. We will be able to see the real impact of the pandemic later. But still working poor, as it has been said in the initial panel, in the introduction panels. It's a reality in Europe, and it's a very worrying reality that we have to deal with, so it fits perfectly in this conference. Very briefly, I would say just few words about the project, because references have been made to inward poverty already, so I don't need to go into details, just to explain to you what is the main added value of our project is that it is focused on particular groups of workers that experience higher levels of inward poverty because they are in a more precarious position in the labor market. So in this sense, we follow a little bit the ideas that were said already, that particular attention is paid to vulnerable workers or workers in a more difficult position in the labor market, and we don't treat in-work poverty as a topic with solutions that fit all workers, but we try to be more targeted in these groups. As it has been said, in-work poverty has multiple drivers. I won't mention them here because to avoid overlapping, just to mention one that maybe was not highlighted. The way we measure in-work poverty has many problems and limitations, therefore, and there are some issues that are very important in Europe that are only partially captured by the way we measure in-work poverty, like for instance, housing costs, which in the country where I come from now, which is Luxembourg, is one of the main countries, is not well captured in the statistic we have, and so on and so forth. So we have an imperfect image of what's the real situation of workers when it comes to in-work poverty because of the limitations of the indicators. And labor law only can do a small part of the work to be done because of the multiple drivers. There are other many important fields of regulation that have a very important role here. Particularly, we have seen that tax law is really, really important. We are not dealing with it in our project, but someone should pay a lot of attention to tax law and its impact on in-work poverty. Our question for this contribution was the regulation and expansion of atypical work in the last decades in the European Union has an impact. It is linked to the increasing levels of in-work poverty. We can say, yes, we have seen some correlation in our project, but it's only part of the whole picture. Still, we wanted to go deeper and we wanted to see what are the flaws or the problems that the current regulation of atypical work at EU level presents, and particularly we wanted to focus on the principle of equality that Mijke will later explain. Here we have some data. You can see how in the last decades the levels of typical atypical employment, I say typical atypical because now we have other forms of precarious employment that are even more atypical, let's say, but we focus here on part-time and temporary employment and agency work. We can see the data here. Part-time employment has went up from 15.6% to 19.4% in the years indicated. And an important thing here is that a huge percentage of this part-time work is involuntary part-time work. And we consider involuntary part-time work also people that report they are working part-time because they have care duties. We consider this also involuntary part-time work. And the share of temporary employment also has grown during the same period, but here we have to be very cautious because when there is a crisis, the levels of temporary employment tend to go down very quickly, so we have to be careful here. At the same time, in-work poverty is much higher. The levels of in-work poverty are much higher on atypical workers than in the general population. For 2019, for the total population of workers, so here we include self-employed, was 9.2% in the European Union, but for atypical workers, we have almost 16%. This is also coherent with data on poverty from non-monetary indicators, so we combine in-work poverty indicators with material poverty indicators to have a more accurate picture. Well, and now I will leave the floor very soon to Mijke. We center in this paper in the 3 EU directives, and we center on the principle on equal treatment. It is true, of course, that the idea of treating atypical workers on an equal footing with comparable permanent or full-time workers is very important, and it has some merits, and it has helped to overcome some problems that these atypical workers have, but still this principle has a lot of problems and shortcomings. This has been studied already since decades, but we wanted to focus on these atypical groups in relation to in-work poverty. I will give the floor already to Mijke because I spoke too much.
Yes, this works. Okay, thanks, Antonio. And I will immediately go further. So yes, these 3 EU directives that we have studied in the context of in-work poverty and this larger project around that. And the problem is with these directives, you might know that they had a very difficult political background. It took ages before we had them. So they are a compromise, and you see that again and again when it is tried to make them work on the level of the Court of Justice, but also on the level of the member states. And the member states have quite some space, actually, to operationalize the key provision, which is in all the 3 directives, the equal treatment provision. Just to show you, before we continue with the equal treatment provision a bit more in detail, this is obvious probably to most of you, but we have 3 sets of atypical workers traditionally. The part-time worker, of course, deviates from the standard worker in the sense that he doesn't work full-time, she or he. Fixed-term workers differ because they do not have an open-ended contract, and temp agency workers differ because they are not directly employed by the one who's also controlling the real day-to-day performance. So about the equal treatment provision that you can find in all the 3 directives. What we see here actually is a difference between, on the one hand, the part-time and the fixed-term directive, which is actually, these are actually framework agreements negotiated by the social partners at EU level, and the temp agency directive, which was adopted in a more traditional way because the social partners couldn't agree on this. What we see actually is that, in particular, the part-time and fixed-term directives show a bit of a difficult equal treatment provision because they are really, really very much depending on an actual comparator. In principle, a comparator which is at the establishment where this part-time or fixed-term worker works, and you might understand, and this is also something we go a bit into in the context in the paper, certainly in the project. There are lots of sectors where these workers who are at the lower end, facing the risk of in-work poverty, are working, where these flexible work arrangements have so rapidly increased that sometimes there is no comparator anymore. So this is one. So this is a really big problem behind the phrasing of these laws for part-time and fixed-term workers. For agency workers, this is different. This is a little bit. This is less the case, but there you have the problem that there's a large scope for derogations by the member states. Also, a problem is, and we can find that in the part-time directive in the preamble at the bottom of the slide, is that social access to social security is actually denied. It's not part of the topic of the directive, but luckily there's gender equality law as well, more general, so that helps at least for part-time workers a bit. What we did in the paper is link the directives where we looked at them separately to some examples in the member states, because of course there's so large space for member states, that's very relevant. And we took country examples mostly from the countries we also study in the larger project. And here we see, for instance, Germany and the Netherlands as contrasting a bit, because the Netherlands actually has included also marginal part-time work, which is possible to exclude. That's one of the main flaws of the directive. And you see that there's also access then, but at a very low level. For instance, if you work 5 hours per week or even less, you can still get unemployment benefits. Of course, that's then not much. That's another problem. You still need flanking measures, but at least it is working to a certain extent. Germany is quite the opposite. They have these mini-job workers. And what is interesting to mention there is that there's now has been a very recently a report which actually recommends the German government to phase out this mini-job scheme. You might know it. These workers are fully exempted virtually from social security, so very, very vulnerable. But why is this recommended? Because it has failed, this mini-job scheme, as a stepping stone to better employment. And that has been the main rationale behind the adoption of all these directives, that they would serve as a stepping stone, these kind of atypical work arrangements, in order to eventually give these workers better opportunities to have a secure position at the labor market. And next to equal treatment, which is the equal treatment which is showing quite some flaws, it was acknowledged in at least the temp agency directive and the fixed term directive that something else is necessary next to equal treatment, and that is protection against abuse. There we see that the fixed term clause is a little bit more concrete than the clause in the temp agency directive, which only says that member states shall take appropriate measures, so virtually leaving everything to the member states. Recently, some interesting case law of the Court of Justice is at least probing member states to take these measures, which was not apparently evident for all at the national level. But focusing a bit more on the fixed term directive, you can say, although it is unfortunately still kept a bit vague, that there is a link here between the prevention of abuse and the fact that contracts of open-ended nature are still seen as the benchmark. This is in the directive, luckily. However, the problem is that it does not translate in a powerful remedy, such as you might have that was envisaged, for instance, by the trade union side, that you say that if there are breaches, that this would immediately lead to conversion of such a contract, not only the fixed term, but also the temp agency, for instance, into a open-ended contract. That would have been a powerful incentive to make something more of this directive than is currently the case. On the other hand, there is some interesting case law, especially on recently on the public sector, focused on the public sector, mostly Spanish and Italian cases, and very recently also Spain has taken measures under the influence of this case law to limit a bit the access to fixed-term work, which is an interesting development, and which you also see partly in Germany, where there's now a pending proposal to say that in certain establishments only 2.5%, if I'm correct, of the workers in a certain establishment can have a fixed-term contract, unless there are objective reasons, of course, to allow for that. But that is an interesting development. I see that my time is becoming limited as well, so I will speed up a bit. Regarding temp agency work, also there are interesting examples at national level, of course stemming from a very abusive situation, German meat sector, for instance, where you had almost 90% of temp agency workers at a certain moment. They are now reintroduced a ban on temp agency work, but conditional. So there is some incentive for social partners to bargain for a collective agreement, and that would then allow for an exemption. Which actually brings us to what we in the paper, a little bit still in the preliminary phase, but see as possible ways to enhance the protection of these groups. Based on what we saw at the case law of the Court of Justice, we stand for a more robust understanding of existing provisions, anti-abuse tools in particular. Then structuralization of precarity, and to counter that links a bit to what we have now, the directive on transparent and predictable working conditions. Next to that, we envisage sectoral approaches, again in the context of these workers facing high risks of in-work poverty, which depends, of course, largely on social partners, and measures to enhance social security coverage. This must also be done at social partner and member state level in particular, linked to the recommendation of 2019 at EU level. But also the last one I wanted to mention, and then I'm concluding, measures to strengthen the stepping stone function is linked a bit to what you now see in Germany with this meat sector example, but also with this limited share of fixed-term contracts in a certain company. This would perhaps be the approach to say, okay, the allowing for these kind of contracts must be made more conditional again on meeting promises that it's really stepping stones, these forms of arrangements, instead of dead-end jobs. Thanks for the attention.
Thank you very, very much. If Carmela and Mijke can come up, and I hope they can bring your presentation up. Do you have a PowerPoint? Yeah. They bring it up. Who's coming first? Okay, go ahead. Thanks. No, wait a moment, it disappeared. Can we have the IT person back? So another interesting aspect of the problem of vulnerability is you're looking at migrants who are in another country when the pandemic broke out.
Yes. So from Ireland.
Go ahead. I was going to say, why don't you start speaking, and then when they bring it up, you do the first slide, okay?
Okay. So good afternoon. I'm Mijke Kelaro, and together. So we
Okay, great.
Great. I'm Mijke Kelaro, and together with Camilla Spadavecchia, we have done a study on the COVID influence of the well-being of the highly skilled migrant in Eindhoven in the Netherlands. Just to give you a bit of background, we can see the map of the Netherlands. We can see the three important economic hubs: airport in Amsterdam, seaport in Rotterdam, and what is called Brainport in Eindhoven. Brainport represents the high-tech industrial hub of the Netherlands, and the region, and it is a city, so Eindhoven is a city, and the 50 surrounding municipalities are located in North Brabant in southeast of the Netherlands. The region is also the tech hub and the critical province for the high-tech related economy of the country. We can see that there are the population is around the population of the Eindhoven is 200,000, and the knowledge migrant workers in Eindhoven are more or less 17,000. The recent pandemic, just to give an actual framework of what has been studied already in terms of COVID impact of the migrant knowledge workers. There are a lot of studies on migrants and COVID, but not much on the highly skilled migrants. If we look into the impact of COVID on the professionals, besides being migrants, what we can see here, we can see the elements that had such a big impact on their well-being, such stress, anxiety, loneliness, social isolation, work-home interference, as the talk, the results of Geary, as he finds, and techno-stress. The corona crisis, during the corona crisis in the Netherlands, it was so-called intelligent lockdown. The term, coined by the Dutch Prime Minister, reflects people's sense of the responsibility and self-discipline. So what is this called intelligent lockdown is basically a lighter version of a full lockdown. There were different, the lockdown were done in several stages, so several times framework during, since the first one, since March 2020. And yeah, the intent was that rather than a state of enforcement, the intent was to minimize the economic, social, and psychological impact of the pandemic. So, for example, the public spaces remained accessible, the public transport remained operational, and the people were not required to have written an authorization to spend time outside. Camilla?
Thank you. Sorry, just put my glasses. All right. So what we did a study. It's an empirical study and an exploratory study, looking at the well-being of migrants and their intention to stay and how that has changed over the pandemic. We did look at it by asking them about their life satisfaction. So they were rating their life satisfaction from 0 to 10 over the last 3 years, so 2019, 2020, 21, and at the beginning of 2022, where the interviews were conducted. And we look into one model of well-being. Of course, there are several models of well-being, and this one is specifically related to subjective well-being that has been elaborated by Gallup scholars in 2012, and it's including 5 dimensions, so job and career, financial well-being, community, social well-being, so social relationships, and health. This model of well-being is including health is mainly in the physical health, but we also look into what is emotional or mental health. And then you see there is a plus there as well after the model of well-being, because we actually left also the questions quite open so that some more items could arrive. The methodology. So the research question is a very exploratory question. Of course, it's a new topic for everybody here. We know that's new. So what we look into is how the well-being has changed over the pandemic and how that influenced their intention to stay. We decided for a very qualitative approach with in-depth semi-structured interview to get information about experiences of the respondents. So it's not to generalize it, but it's to understand their experiences, and then in the next step, conducting a survey to test the factors that emerged here. So we look into 2 groups. A group of people who actually left Eindhoven after and during the pandemic, so in 2020 actually, most of them, and people who stayed in Eindhoven. In terms of life satisfaction, this is very, it's just to show you some ideas on how they rated their life satisfaction over the years. So if you see the one in blue, the bar in blue is the one of people living in Eindhoven, currently living in Eindhoven. In red is people who left Eindhoven, and then in yellow is the average. And here I'm just showing the average of their responses. So if you see the life satisfaction of everybody decreased in 2020 and then started increasing in 2021, but we see that the people who actually left Eindhoven had a very much low satisfaction of their life in 2020, and that's actually the moment in which they decided to leave. Sorry, just wanted to say another thing here. And the life satisfaction became very high in 2021 when they actually moved. So, and that's quite common. The life satisfaction changes right after the move, and then they normalize again. It normalized again. So we have some results. Then I'm showing some results according to the well-being model. So there is, first of all, there is a difference between entrepreneurs and employed respondents. So this was not a control variable, but we actually see that all people who were employed didn't actually have any issue, negative impact on their result in their job and career. But people who actually were entrepreneurs, and especially they were self-employed, they did have strong impact on their career. Of course, they had to close their business because most of their businesses were related to connections with other people. There is also a big difference in the work pressure for people who had families and people without families, and I think John really showed it before with very beautiful pictures. So people who had a family initially struggled quite a lot in managing family and work because there was a strong interference of work in their daily life. But also people who had been who are singles and living alone, they actually experience a sense of loneliness, also because they were cut off by also the other social connections. And techno-stress is something that has been seen in all respondents as well. Just a remark about this. The people who actually are employed, I have to say this, they are in a very high positions. So we are talking about highly qualified migrants who have very good and permanent jobs. So they haven't been affected because of that. So we're talking about a privileged group in a way. In terms of economic well-being, we see the same differentiation, like between people who actually are entrepreneurs, they lost a lot of money, and people who actually are employed, they actually could save even more money. I remember one respondent say, I'm even richer than I was before. I could never save as much money as I did during the COVID before. And then also entrepreneurs, like there is a very important part here because they did not receive support, economic support from the government. There were measures to support entrepreneurs, but for bigger groups, at least to the experience of our respondents. In terms of community, we look into several elements. So we look into a sense of safety, and all people except two felt very safe in the region. And they didn't see a big of a change in terms of safety during the COVID-19. In terms of trust in the government, that is, I think, the most significant finding we have. So we did a very similar study before COVID, the pandemic, on the well-being of highly skilled migrants in Eindhoven and the intention to stay. And trust in the government at that point was absolutely not relevant for all of them. In that case, we did a survey with hundreds of people. But now, with this, with the pandemic, we actually see that the trust in the government is an important element for them, and for some of them actually influenced their intention to leave the country. They did not trust the government because they thought they had a weak measure with respect to what the measures that they had in their own country, so they were always comparing the two countries. And they also felt that there were no support for people, especially, as I said before, entrepreneurs. But they actually could enjoy very much the fact that they were not locked inside a house. So there was this other side of the coin, I would say. The sense of belonging. Sense of belonging has changed during the pandemic, but it was already very weak before. Except of two, all the others responded they do not feel a strong sense of belonging to the community there. And that is one factor influencing their intention to leave. That when the COVID arrived, the COVID just made like the final push for them to decide to actually leave the country. And volunteering has been seen as a very important element into building up a sense of belonging. Half of our respondents, they do actually have volunteering experiences before COVID. They felt a bit more connected, but they still did not feel that they belong to a community there. In terms of social connection, of course, there's social connection, and the way they meet people has changed quite significantly during COVID, and especially in the beginning when they were more strict on not seeing other people. Of course, here we see a difference, again, with people living alone and people with family. Those people living alone felt more isolated. And an important part here is that people started to select friends to meet. So they were starting to look into their inner circle and decide, well, I will meet those two people, and then the other people that I know that we are kind of friends, we are actually going to meet online, right? So there was this kind of selection that for some respondents released a lot of pressure on meeting constantly people. On the other side, some people felt that they really understood that they were not belonging to any inner circle, and that actually influenced their intention to leave. In terms of health, we see physical health, trust in the health system, and emotional health. So physical health has not been mentioned as strongly being impacted by the pandemic. But trust in the health system also has not been impacted, but I have to say that people do not trust the health system. They complain especially about the high cost of the insurance system, the general practitioner bottleneck, so they cannot see a specialist as much as they would like to see. So some of them are actually flying to other countries to see a specialist, or they go to Belgium. But there is no change in trust in the health system during the COVID-19. A very important area that has been impacted is the emotional health, emotional or mental health. So almost all respondents, well, all respondents did actually mention some sort of anxiety or some sort of stress or depression, especially in the very beginning. And all of them also connected this to the climate of uncertainty that they were experiencing. So they didn't know when this would end, of course, as all of us, but also if they could start working again from the office or can start their life again. Yeah. There are positive impacts of the pandemic, and especially I see here for people with family, living with families, after the very first phase of struggling in managing everything, they actually felt like, well, there is still a challenge in managing everything, but we actually strengthened our connection with the other family members. That is something that all of them actually mentioned, all of the people with a family. There is a sense of resilience. A lot of people mentioned that they were starting, because they couldn't go outside, they started to be more looking into themselves, to become a bit more introvert, and started to look into what their fears are, or how they can handle situations that before they were like avoiding handling. And they all mentioned, not all, sorry, most of them mentioned that their resilience increased. And then some people, that's just the mother of 3 people actually, they did mention that they could connect more with nature. Because they could walk in parks, and then they could decide to go there every day and start to create a connection with nature, which increased significantly their well-being. But COVID is a push factor. It's not the only factor. So it's not that the COVID in itself pushed people away. It's more than COVID functioned as a last pushing factor in the decision to leave for people who already had the idea of living. Working from home, a lot of people who actually started working from home, I'm closing, actually mentioned that they initially thought that it was not for them, but in the end they like it, and they decided to ask for permanently working from home. And then they left the country. So they had the Dutch conditions, which are very good conditions according to them. They were really happy to have the Dutch working condition, but in a different environment in which they feel they belong. Yeah, I'm going to close. Besides physical health, all the other elements have been really impacted. And for the next studies, what we can see, and we also are going to do that, but we can test those factors together with other factors in a survey and to make it more statistic in a way. So thank you very much.
Thank you. You know, it's terrible being the timekeeper. Olga Cheselina from the Max Planck Institute is following up in a way about the psychosocial risks.
Okay. The topic of my presentation, my name is Olga Cheselina, and the topic of my presentation is psychosocial risks and mental health of employed persons in the post-COVID world of work. Is something? Okay, and the goal of my presentation is to determine whether a systematic and holistic approach concerning mental health and psychosocial risks of workers is already applied at EU level, or at least follows from the new regulatory initiatives. And I would like to start with analyzing the regulatory acts, as well as the recent legislative proposal at EU level concerning these issues. The most important hard law source in the field of OSH is the Framework Directive of 12th June 1989. The Framework Directive is aimed at fixing minimum requirements in OSH. The Framework Directive is based on the prevention principle, which requires employers to ensure workers' health and safety in every aspect related to work and addresses all risks, including psychosocial risks, and the risk pros and cons of the all-embracing broad scope of the Framework Directive. On the one side, the all-embracing broad scope of the Framework Directive that covers all risks without mentioning them by name has an advantage because it allows to cover also these risks that did not exist at the moment of the adoption of the Framework Directive. For example, psychosocial risks, but also psychotechnical risks connected with, for example, the algorithmic management and the digitalization in general. On the other side, the boundless broad scope of the Framework Directive that does not list risks poses huge challenges concerning its implementation and enforcement. And it's stressed in reports of the European Commission that there are huge problems with the implementation of the Framework Directive concerning psychosocial risks on national standards of the member states. And it is a big problem because the broader the definition, the weaker the enforceability. The next general problem concerning EU law is that it does not contain definitions of terms, the most important terms like mental health, psychosocial risk, well-being and work, and so on. Another obstacle for the legal regulation of psychosocial risk is their complex nature that includes occupational and non-occupational factors. And due to the increase in the use of remote working during the pandemic, it is getting even more difficult to differentiate between internal factors related to the workplace from external factors related to the employee, his physical state of health, family situation, housing situation. Furthermore, issues concerning psychosocial risks and mental health at work at EU level are still mostly a subject of non-binding acts. And many of issues concerning mental health have already been on the agenda for a long time. It was proposed to elaborate a recommendation on mental health at work or to change Screen Display Equipment Directive. However, this has not happened until now. Nevertheless, in most recent years, the EU has recognized that psychosocial risks are one of the main challenges for occupational health and safety for the future. And it is connected with the coronavirus pandemic. And it was already stressed that working from home patterns are often connected with anxiety, social isolation, and especially women who have to care on children and other family members are exposed to psychosocial risks. But also essential workers, for them also many risks and hazards of psychosocial nature are the same as for remote workers. And the negative effects increase the longer the pandemic lasts. For example, in Germany, the number of sick persons with mental disorders rose from 13% in 2020 to 18% in 2021. And the EU Strategic Framework on Health and Safety at Work for 21-27 focuses on psychosocial risks as one of the most important challenges. I will only briefly mention two initiatives. It is the draft directive on the right to disconnect and the initiative non-binding initiative, Mental Health in the Digital World of Work. And the draft directive on the right to disconnect, it's a good example for the fragmentation in regulation of psychosocial risks, because this draft directive addresses only the issue of hyperconnection, leaving without answer this challenge like intensification of workload. On the other side, this draft directive provides measures implementing the right to disconnect, and these measures would be also important for the intensive workload, for example, in work training or psychosocial risk assessment. And the other initiative concerning mental health in the digital world of work, it will be also non-binding document at the end. And in the moment it is not clear whether it will cover also self-employed persons and the relationship of this initiative to other initiatives in this field. I would like to move to the question personal scope of the right to mental health at work. The Framework Directive applies to employees but not to self-employed persons. And theoretically, the broad interpretation of the Framework Directive allows to include at least non-workers working within employers' premises, because employer is also responsible for the effective functioning of the enterprises. But in the end, the type of employment should not make a difference in terms of health and safety. Empirical evidence shows that often recognized cases of mental disorders concerns employees and also self-employed persons in service sector. And in these areas, there are a lot of cases of bogus self-employment. And plenty of hazards of psychosocial nature are similar for employees and for self-employed persons. But there is a huge discrepancy between a political will to include self-employed persons in the scope of the regulations concerning OSH and concerning protection against psychosocial risk and the draft directive in this field. For example, the Committee on Employment and Social Affairs stresses in its report of February 2022, protecting people from health and safety hazards is a key element of achieving decent working conditions for everyone. I will come later to this issue. I will also show that the Framework Directive takes into account particularly sensitive risk groups. These groups must be protected against dangers which specifically affect them. And in 1990s, to these groups belong in particularly workers with fixed-term employment contract and temporary agency workers. And the reason for special regulation of OSH of these workers was evidence that such workers, especially in certain sectors, are more exposed to the risk of accident at work and occupational disease than other workers, because they do not belong to the core workforce, being rather contingent to the undertaking. I would like to stress that temporary character of an employment relationship itself is not seen in EU law as a reason for specific additional rules. And nowadays, platform workers, in my opinion, represent modern, particularly sensitive risk group. Empirical evidence shows that psychosocial risks from platform workers are likely to be significantly higher than for workers of traditional companies because of poor working conditions, especially for on-location platform workers, and because of the use of the algorithmic management that leads to the intensification of the workload. And however, it is problematic to find a comparable permanent employee in the field of platform work to guarantee the equal treatment of platform workers, because platform workers of one and the same platform are employed at the same basis mostly as the self-employed platform workers. And the resolution of the European Parliament of 16 September 2021 stresses that it is necessary to address not only physical risk of platform workers, but also psychosocial risk connected with unpredictable working hours, intensity of work, competitive environment, and so on. And the proposal of a directive on improving working conditions in platform work provides that digital labor platforms shall in particular evaluate the risk of automated monitoring and decision-making system to the safety and health of platform workers, in particular as regards possible risk of work-related accident, psychosocial and ergonomic risks. And they shall not use automated monitoring and decision-making system in any manner that puts undue pressure on platform workers or otherwise puts at risk the physical and mental health of platform workers. It is problematic that Article 7, Part 2 of this draft directive shall not be applied in relation to self-employed platform workers. And at the same time, the question whether the application of the algorithmic management indicates the personal dependency of platform workers is still open. And I would like to conclude my presentation with two key questions. Who should be covered by these regulations on mental health and protection against psychosocial risks? Employees, dependent self-employed persons, or also genuine self-employed persons? And second question, what is the best way to address psychosocial risks in your law? For example, concerning platform workers, is it the best way to regulate psychosocial risks of platform workers in directive on improving working conditions in platform work? Probably it would be a good solution because it could increase attention concerning psychosocial risk of platform workers and because the algorithmic management still prevails in platform work. But on the other side, I think it's necessary to add the framework directive with regulations on psychosocial risks, and the draft directive of 1989 fits perfectly to this goal. But it's also necessary to adopt a new framework directive on psychosocial risks, and the Committee on Employment and Social Affairs in its report also stresses that calls on the Commission to propose, in conclusion with the social partners, a directive on psychosocial risks and well-being and work. And at the end, I would like to say that the new ISO standard, Occupational Health and Safety Management, Psychosocial Health and Safety at Work, could be a good basis for such directive, which provides 3 tables defining hazards of psychosocial nature, concerning the organization of work, social factors at work, and work environment. Thank you very much.
Thank you. That was perfect timing. Now, I don't know what's happening because I do know our discussant, Carla Spinelli, is not here. Is she coming? Do you know if there's a... Somebody said that she might be videoed in. Let me just, give me a second and I'll see. I'm told that Carla is online and that we will be able to hear her but not see her. Okay. Carla, can you hear me? Carla? She just disconnected?
We are going to call her.
We'll call in 1 minute, otherwise. I will say that it's been a very rich afternoon, and I appreciate all the speakers. We hastened everybody racing through their presentations. I hear something. Carla? Okay. Carla,
I'm sorry,
you
can you hear me?
Yes, we can. Why don't you start? Start now.
Thank you so much. I'm sorry, I had problems with the connection.
Okay. Oh, we can see you. Go ahead.
Okay. First of all, I would like to thank the organizers because they let me participate to such an interesting panel. Moreover, I apologize for not being there, but it was a problem of caring vulnerable. So I am perfectly in the mood. Apart from this, I would like to share very few and brief remarks which concern three main common or the notion of vulnerability on the whole of
can I say something?
On the first point, it seems that can you hear me?
We can hear you, but you're being,
okay, sorry.
No, you
the
might
first
want to turn the
point
video.
The category of vulnerable workers.
Can I suggest
on
that
one
you
side,
turn the video
we have,
off? If you turn the video off,
it has
we'd be
been
able to hear you
presented
better.
some category of vulnerable workers, well known. I think of disabled people or atypical workers. But we have heard also about new category that enlarge the very notion of vulnerability. This is the case during the COVID pandemic of fragile people or because of their illness. But we have also heard in this session panelists speaking about a category we do not imagine that could have been considered as vulnerable because they are highly skilled, like migrants, or highly performing, like people with Asperger or other kind of autism. So the COVID pandemic, in my view, has emphasized and a little bit changed the notion of vulnerability. In a traditional perspective, also self-employed people have been involved in this concept because of the effect on them of the pandemic. Regarding the third point, the question of digitalization, we have heard what kind of role it can play with respect to vulnerable people. Just imagine or just consider the case of disabled people. The remote work have represented during the pandemic a possibility for them to be considered as kind of reasonable accommodation. But as it has been analyzed and underlined, this is not always the right case. There will be situations in which remote work cannot be used such a kind of reasonable accommodation. On the other side, from a gender perspective, remote work has proved not to be for sure an instrument of work-life balance. So digital work can have both a good or a bad impact on vulnerability, depending on which is the specific case. For example, the question of voluntarism has been underlined. It is necessary that remote work is a choice of the worker to be sure that it can have a good impact in terms of affording vulnerability. On the other side, thinking of digitalization, we have also heard about the right to disconnect or platform work impact in terms of algorithmic management. And all this in this situation, there are new vulnerabilities or traditional vulnerability that can be afforded according different regulatory techniques. And I came to my third point, the role of the European Union legislation existing or forthcoming. Regarding the health and safety protection, we have heard that because of a wider definition in terms of its scope of application, it can cover new situations, but it can also suffer in terms of enforceability. At the same time, looking at the forthcoming legislation at the EU level, we see that we have different instruments. A resolution on right to disconnect, a proposal of directive on platform work, a regulation on artificial intelligence that, in my view, do not speak one to each other in the right way. They try to afford the same problem with different regulatory technique. I think regarding artificial intelligence regulation, the focus on the kind of risks and how to afford them. Regarding platform worker and algorithmic management, it's very peculiar, the fact that the directive says that it is going to be applied also to self-employed, but if we read Article 7, paragraph 2, we read that self-employed indeed are excluded from some kind of protection. And on the contrary, the right to disconnect is regulated with respect to all workers, not only subordinates, but it has to be considered also in the light of the digitalization framework agreement of the social partners. So regarding this last point, in my view, we were very happy about, I think, the enactment of the social pillar. But what's going on in terms of its implementation leave a lot of room of not so clear perspective adopted at EU level. And as a consequence, also national regulations, in my view, appears to be not yet ready to find or to consolidate or to find new settlement of regulatory technique to afford, which is the main focus of this panel, new or old vulnerability as impacted by the COVID pandemic and in terms of human-centered approach. Thank you so much.
Thank you very much, and I'm glad this worked. Thank you. In light of the time, I'm going to call this session to a close, and I would say if you have questions or want to further discuss, well, go up to the speakers at the reception tonight or during our breaks tomorrow and further discuss the many rich themes that came out from today's speakers. And also they had so little time to present their papers, which of course are available online, but you may want a further discussion. Thank you for staying to the end this afternoon, and I'll see you at the reception tonight.